Okay, so our next speaker is Dr. Becky Saadian, and she is an NHS GP and a British Menopause Society accredited menopause specialist. She completed her menopause training at Liverpool Women's Hospital and King's College Hospital, London, and works with both within the NHS and as a specialist clinician for the Women's Hormone Clinic, supporting women across the UK. An alumna of the University of Liverpool, Becky first qualified with a Bachelor of Nursing before going on to study medicine at the University of Leeds. Her dual background in nursing and medicine gives her a uniquely holistic approach to women's health. Outside of clinical practice, she's a married mom of 3 and passionate about empowering women with clear evidence-based guidance on a range of hormonal health issues. Please join me in welcoming Becky.
Thanks, Casey. So I'm not a lecturer, I'm a GP, and I'm normally used to just speaking to one person, so please bear with me. So I'm here today to talk about the intersection between neurodiversity and the menopause, which is becoming increasingly recognised in clinical practice, but is still very much under-discussed. So, see if I can work the computer. Yeah, I think so. Yeah, so Casey's introduced me, thank you. So I am a specialist doctor at the Women's Hormone Clinic, and that's an online UK-based service that I will talk about at the end as well. So why does this conversation matter? Well, menopause symptoms overlap with neurodivergent traits, and neurodivergent women are frequently underdiagnosed or misdiagnosed. We know that hormonal shifts can amplify executive dysfunction, sensory issues, and emotional regulation challenges, and it can impact on a woman's work, relationships, and well-being. The average age of menopause in the UK is 51, but we know that perimenopausal symptoms can last long before then, and actually ovarian function goes into decline from the age, really about age 38. So we all know what neurodiversity is. Neurodivergent people bring unique creativity, problem-solving perspectives, and a diverse range of talent. And it's a natural variation in human brains, not something to be corrected. There's lots of different examples of neurodiversity, but just for today, we're just going to talk about ADHD and autism. Neurodivergent brains, we know, respond differently to hormonal challenges. So the first bit is about ADHD. So estrogen is produced by the ovaries, and as the ovaries start to go into decline, our estrogen levels start to go a bit crazy before completely dropping off. Estrogen is really important for dopamine production and signaling. And dopamine is a chemical messenger that has an important role in focus, motivation, reward, movement, and mood. I like to think of it as like the accelerator in the car. We know that in women that have ADHD, the dopamine pathways are less efficient. Estrogen can help the prefrontal cortex regulate attention, memory, and emotion. And also estrogen can improve the response to stimulant medication and make those dopamine pathways more efficient. So having a steady estrogen level is really important because it maintains dopamine stability. So in the clinical picture, midlife can worsen ADHD symptoms, and these can overlap with menopause symptoms as well. And often people can become misdiagnosed at this age as well, and many women can present with ADHD for the first time, and it can be misdiagnosed as many things, and brain fog can interlink with that as well. We know there's a later diagnosis for ADHD in women, and it's often recognised after many years of compensatory strategies and masking. There's also a higher mental health burden at diagnosis. And we know that for women who are already on ADHD medication, perimenopause can destabilise previously effective regimes. For the first time last year, the British Menopause Society included neurodiversity in its annual conference, and it did look at the research around ADHD and menopause. And female-focused features in ADHD are often under-researched, and actually ADHD tends to be more centred on boys, externalising behaviours, and teenagers to adolescents. There's no objective biomarkers for ADHD or really for menopause as well, and it's often symptom-based self-reported diagnosis. So there's a big lack of research in this area. Moving on to autism and menopause, the key challenges are that sensory sensitivity intensifies. So vasomotor symptoms like hot flushes, brain fog, sleep disruption, and temperature changes can heighten sensory overload. We know that many autistic women struggle to articulate internal states, which we know is interoception, so thirst, hunger, temperature, pain, and they may not recognise menopausal symptoms as such. There can be masking fatigue as well, so long-term masking becomes harder as the cognitive load increases in menopause. And there's a higher rate of coexisting mental health conditions as well. And as the brilliant speakers mentioned before, there can be difficulty adapting and accessing services such as GP. We also know that for treating menopause, some particular types of HRT can be also cause sensory problems as well. So what does good support look like? So it's trauma-informed, so safe, trustworthy, transparent choice for women. And it's a collaborative approach between GP and the patient that's culturally appropriate, and neurodiverse affirming. And what I mean by this is that neurodiversity is a natural variation rather than a deficit to be corrected. Good support involves a multidisciplinary team, so the patient's GP, a menopause specialist, and other professionals as well. And that's why it's great to hear about the Autism Hub and other services that can be offered. So what are our treatment options? Well, HRT. So HRT provides a steady state of hormones throughout the course of their menstrual cycle to hopefully alleviate those fluctuations. ADHD medication if appropriate. Lifestyle support, because we know that lifestyle is just so important for menopause as well. It's not all about HRT. It's how we eat, how we sleep, how we exercise, how we look after ourselves in terms of self-care, and psychological support as well. So basically, no one size fits all. So just a few quick practical strategies. So this is for everyone actually, not just for people with neurodivergence, but basically externalizing memory. So if you are someone that's struggling with brain fog, alarms, calendars, that sort of thing, sensory friendly environments, breaking tasks into micro steps, predictable routines, calming routines and self-care. So I've put here, this is box breathing, which some of you may have heard about. There's lots on the internet about that. There's also the breathwork app, which is quite helpful. Calming routines and self-care and adjustments in the workplace. So just very quickly, what can the employer or university do? So I've just put here to remind me, this is Liverpool Heart and Chest Hospital. So I was at a talk for menopause specialists in the region recently, and Heart and Chest had a representative there who was a nurse who put into place a menopause box in the workplace, and it had things in it like spare change of scrubs, cooling spray, a fan. I think there was pads, spare underwear, positivity cards, and I just thought that was a really nice thing that employers can do. So things that we can do is sort of flexible working, quiet spaces, clear communication and written instructions, predictable schedules, and supportive HR and occupational health pathways, which I know the university has. So the key takeaways. So neurodiverse women can often experience menopause more intensely. Symptoms are very easy to miss. Hormonal changes can unmask or worsen neurodiverse traits, and support very much must be personalised. And with the right care, women can thrive. So just a few resources. So there's some brilliant books out there. There's one called Autistic Menopause. There's Menopause and ADHD, which is a new book written by an amazing GP called Dr. Helen Wall, who's very active on social media. the British Menopause Society has some excellent leaflets on the Women's Health Concern, which is its patient arm, and this is its Menopause Wellness Hub, which has lots of really good fact sheets and videos. So I work privately for the Women's Hormone Clinic, so we're also very active on social media, and we also have a website and blogs on there as well. And there's lots of charity sector work as well. So yes, so that's me. So if there's any questions that you want to ask, I know we've got the question bit at the end, but obviously this is quite personal. So if there's anything that anyone wants to ask, you can feel free to email me. And if you were interested in looking at what we offer, that's our website and our social media handles as well. Okay, thank you.